Thanks very much. Well, of course, I don't have a PowerPoint presentation for this end of the day. You'll be glad to hear. I wasn't quite sure at the beginning how I was going to be able to actually round this off. But I think the first thing I should just say is, wow. I think this has been a really, really interesting afternoon. And I've got a way forward, which is always a good thing, because when you're rounding up at the end, you've got to have a way forward. So transforming health has already had a big impact on our health system. People are now talking not about whether we should transform health, but how we're going to do it, how we're going to get involved, who's going to evaluate it, how it's going to be researched, how it fits in with educating our students, how it really fits in with authentic patient communication and involvement. So we've already started. We're further down the journey than we actually realised. So I think that's one of my causes for celebration. So I'd like to thank you all for that enormously. Now, I know that particularly in this audience, choosing to start with acute care is maybe not in everyone's interest, not their favourite area for starting, but do you know, I'm not going to apologise for that. We've made the case for change and we're going to move on, but we're going to become broader and more expansive and ripple out into those areas as well. So don't worry, it's all inclusive. It's just that we have to start where we're starting and we're going to move on, because otherwise we'll get ourselves so tangled up in trying to redefine what we're doing that we won't actually go anywhere. And I really am the sort of person who has to get somewhere to demonstrate that we've had an effect. So of course, looking at this, it's obviously an action, research, learning and everything thrown in occupation. So my challenge is to put the 8 chief investigators who presented today into a single project. And then that's the one we've got to do first. So, just for fun, I mean, this is not, you don't have to do this, but this is just what I was thinking as I was sitting there. So we've got to choose a topic. And the topic to choose has got to be one of the first working groups from Transforming Health, because this has got to show that this group, SAMRI, the SA Centre, the universities and Transforming Health can all do something together. And Transforming Health is not, and the Department of Health, are not going to get involved in something that's actually not part of the first tier of Transforming Health activity, because that's a distraction from trying to get some runs on the board with Transforming Health. So, okay, we could choose stroke, because everyone talks about stroke all the time. We could choose diabetes, although it's not actually, we don't have a working group in diabetes yet, but that would bring the diabetes part of the work in. We'd have to look at the population data. We'd have to look at LARS. So you see I'm definitely stepping through the talks. We'd have to model the changes. I know I wasn't here for Bob's talk, but I do know what it was about, so that's good. And we have to map the journey for the patients along whatever model of care we choose. Then we have to work out how we're actually going to implement it, because of course we always get to that point of implementation and then do we get any further? Now we can model the implementation and then we can go down the implementation path, and then we have to evaluate it and go round again. So it really is an action learning project. Now, to bring Greg's talk in, the next Directors Forum of Transforming Health, which includes the directors from all across the LHNs, is actually going to be focused on implementing all those fantastic palliative care policies and 7-step programs and goodness knows what else is, and conversations about dying that we've got there. You've got 1,000 policies and procedures. It's just that they're not implemented. What we're trying to do is wordsmith the wording that goes in every single one of our pathways of models of care of Transforming Health that trigger, and then this is what you do, because we keep talking about the avoidable deaths, the 500 avoidable deaths. If we spend 250 million on our Transforming Health and we save 500 deaths, 500 avoidable deaths a year, that's a good thing. But what we've also got to do is make sure that we respect and treat properly the unavoidable deaths, because there are unavoidable deaths that should happen, but they should happen with proper communication and proper care. So that's actually taken care of. We are going to model the impact of the nurse-led restorative care, and it may not be in the hospitals in the end, because that might be the wrong place for it, but that's a work in progress. But of course, the bit I absolutely adore is the education research and the lifelong learning and the how we build that in, because obviously we have to adjust our education to our health system. And if we go in there proactively researching our education in our health system, then it's not so scary for the students. And if we get the students involved in how we actually improve the education system, that'd be a first. And actually, you know, again, it's like having a workforce strategy. Who knew we didn't have a strategy for the future of our education? But, you know, we actually need to build that in. But I'll take it one step further with the lifelong learning. There's another, I mean, I think it's a fantastic offer from Flinders for the waiving the fees for the education masters. But what about the leadership and organisational psychology masters? I'm just about to submit my thesis for a master's in org psych and medical leadership that I'm doing in the UK, which, you know, we don't have. The reason I'm doing it in the UK is we don't have it here. And actually, Transforming Health gives us a perfect opportunity for developing that at our universities, because this whole program is about change, and about change management, and about change readiness, and about leadership training, and about getting all of that going across our whole system. So basically, we need a demonstration of how Transforming Health, the AHRTC, whatever it's called, centre, the universities, and this community of research practice can actually deliver something tangible as an outcome of Transforming Health. So that's what I would challenge this group to do going forward, to get those people in a room and talk about the project or the sub-projects that we could actually do. Because best care first time every time, and healthcare heaven in South Australia, patient-centred, clinician-led, evidence-based, data-driven, and underpinned by the electronic health record. Easy. Thank you very much indeed, and well done, everyone.
Right, we've got there. And the drinks are just about ready. So, first of all, thank you, Dorothy, for that great wrap-up. I think we've given us quite a challenge, so we will take it up and see what we can do. I also would like to thank all the speakers. I think they've done a great job of bringing together, presenting a whole lot of different research ideas, and yet, as Dorothy said, they are all linked in some way. And yes, Transforming Health featured every time, but that was not unplanned at all, was it? But I think there's some really good ideas. We will continue to discuss them. What I want you to do now is take that evaluation form and complete that, so that we, as the group of 5, 6, can work out what we're going to do next. So just to let you know who they were, if they can stand up, we have John Carnan. It's like, you know, these are the winners. John Carnan, who's president of the Australian, the Health Services Research Association, Australia, New Zealand. Sarah Green, who's the secretariat. It's amazing what she's done behind the scenes. John's also from the University of Adelaide, so thank the University of Adelaide for hosting this. We have Julie Marker, who's chair of Cancer Voices South Australia. You've heard us ask a few questions. We've got Carol Davey, who's with the SAMRI, and right? Sorry, I'm not that good on pronouncing things. And we have Christina Hager from PICRIS, and myself as well. Christina is also the convener of the conference at the end of this month, so just in our spare time we've thrown this together. So this has all been a really good exercise in that respect. So thank you all to those. Now, some of you might have been wondering about blue dots on the name tags. I meant to tell you afternoon tea, they're the people that have got their abstracts in the book. So if you want to speak to someone about what's in the abstract, then look for the blue dot. If you weren't registered, didn't have a name tag when you arrived, and would like to be kept in the loop, can you make sure you put your details on the evaluation form so that we can make sure you're on the list? I think I've just about got everything. Can I just have the speakers from the last session join us up here so we can take a photo with, hopefully, Dorothy, if we've got the minute. So thank you again. We'll see you at drinks, and we'll see you next time. Thank you.